sometimes the video doesn't totally match up exactly with the checklist, but we'll go by with what the checklist says. We want to make sure we have suction equipment here at the bedside. So this is what our suction equipment would look like. And then we have this like bigger suction tubing here. Here for right now. And then again, we want to check, we want to have a baseline set of vitals and a baseline lung assessment before we start sectioning. So we're evaluating our patient's airway, making sure that, because we want to clear their airway and make sure that they can breathe better. So we want them in a high Fowler's to Fowler's position, so 30 to 45 degrees. If I'm right-handed, I want to stand on the right-hand side of the bed so I can use my dominant hand to section the patient. We're going to put a towel across their chest, like this. And the PPE kind of depends. The video shows the person in like a full gown and gloves and mask and eye protection. So again, it kind of depends. If, when do you think I would want to wear a gown?
When the patient has contact is in contact isolation that need gown.
Yeah, of course,
yes.
if they're in isolation, I would wear a gown. But it's kind of, up to your judgment. If they're actively, having a productive cough, then yeah, I might want to wear a gown and a mask and eye protection, but it just kind of depends. So I checked the vital signs, placed them. I want to check to make sure that my section is working, so I'm going to turn it on, make sure that that's working. And then this end of the section tubing, I'm just going to sit here so it's accessible for later. Okay, so now I'm going to open up my kit here. This first part of your checklist says apply non-sterile gloves, but in the video he's not wearing any gloves, so really for this part, setting up the sectioning, putting the chucks on the chest, you really don't need to wear gloves. Okay, so I'm gonna, this is for my part 2. Okay, so I'm gonna open up my kit here. So again, we wanna, the inside of this is sterile, so I wanna be careful about, just touching that 1-inch border. Like this, and this can kind of become a little bit of my sterile field. So in here, you have a little kit itself. So the first thing you're going to grab is this basin. So what's going to go in here? So I'm going to put saline in here, right? So this is basically a little cup. So I just want to make sure that this part is sterile where the waters can go, right? So as I pulled it out, I can grab the outside and the corners, and I can, use this part to kind of set up my little box, but I don't want to be putting my fingers anywhere on the top here. I'm going to put normal saline in there. But if this was a multi-use bottle, right? If it's brand new, then I'm good just to pour directly in here. But if I've used this bottle before, because maybe they were sectioned a couple hours ago, what should I do before I pour anything into here?
Disinfect it.
Kind of, right? That's a good thought. So what we'll do is we'll pour a little bit into the trash, right, to get rid of any like biofilm or microbes or anything like that. Then I'm going to pour it into here. So if it's a multi-use bottle, we want to do the first little bit into the trash, and then I'm going to pour into there. So I've got that done. Okay, so you put approximately 100 ml water or normal saline in there. Okay, so now this is where my sterile part comes in. So in here are my sterile gloves. And there's a suction catheter. So this isn't as, you know, what do I want to say? The sterile technique isn't as strict as my Foley catheter. But we do want to
That's
still be
right.
careful when putting on our sterile gloves. We want to only touch inside of the cup. Okay, so now I've got my sterile gloves on. So in here now I can touch all this. So this is my section catheter. So with this, shortly I'm going to have one hand that remains sterile and my other hand is going to become clean, right? So this part, this is the suction catheter that's going to go into the tracheostomy. So I want to keep this end nice and sterile, right? And I want to have control over this. I don't want to be having this thing swing around. So you can see in the video they say, you know, kind of coil this around your fingers. You know, keep good control of this part, basically. So now at this point, let me just make sure I'm following all the steps. Okay. So I also, okay, so now I have to connect it to my suction tubing. So I have my suction tubing here. So as soon as I do this, this hand is clean, right? So we're gonna connect it just like this. So this hand is still remaining sterile, this part is sterile. Now it's hooked up to my section. So my section's gonna be on. So now the first thing I wanna do is I wanna kind of test the section and like lubricate the tip of the catheter. So anytime my thumb is down, it's sectioning. So I'll put my thumb down, I'll kind of section, there's gonna be fluid running through the tubing. I can see that the section's working and I can lubricate the tip a little bit. So now I'm ready to section the patient. Depending on your patient, you may need to hyperoxygenate them. So if because are they gonna be able to breathe very well while I'm sectioning them? No. So depending on how low their oxygen saturation was, or you know, we might want to hyperoxygenate prior to sectioning, but that depends patient to patient. Now, if I wanted to hyperoxygenate this patient, how would I do that?
Give oxygen before the
Yeah, so
procedure.
I can get, you know, with my clean hand, I can have an oxygen mask or something here that I'll put over the tracheostomy. I'll ask the patient, okay, take some slow deep breaths, and that helps hyperoxygenate them before the procedure. Also, before I start, so I would have explained to the patient what to expect and what do you want to establish. I think the video mentions this, because my patient might not be able to catch their breath, they might not be able to talk during the procedure. So you want to establish some sort of communication, right? Like, okay, if at any point during the procedure you need me to stop, or you're not feeling good, you know, raise your right hand, something like that. So some sort of, you know, communication where the patient can communicate with me. Okay, so I'm ready to section. So I lubricated the tip, I checked the section. So now I'm going to insert the catheter into the tracheostomy. It says to like a predetermined length, so sometimes there may be a predetermined length that's been charted by the respiratory therapist, or you can insert until you feel like some resistance, which means maybe you're at the, where the bronchi kind of bifurcate, so you just hit that point. Oh yes, okay, so when I am inserting the catheter, is my thumb up or down? Up. Yeah, so I'm not sectioning on the way down, but I'll show you I'll section on the way up. So you want your thumb up. So you're going to insert the catheter until I feel some resistance, or until I know I'm at my predetermined length. Then on the way out, I'm going to intermittently section with my finger, and you can kind of twist a little bit like this to get the sides of the inner cannula. I'm gonna rinse in between and go again, right? Kind of move your hand up here to kind of get more control over this. So my thumb is up as I'm inserting the catheter. When I feel resistance, I'm gonna intermittently section and twist on the way out. Now, how many section passes can I make? So max of 3, right? And they should only be 10 to 15 seconds, right? We're not going to section someone for 30 or 45 seconds. They're not going to be able to catch their breath. So, you're going to count or look at a clock, something to make sure that you're within that 10 to 15 seconds. And then as it comes up, you're intermittently sectioning and then rinsing in between. So I did my 3 passes. I can't do any more after that. So after that, so I can disconnect this, that becomes trash. I'm gonna put this back, and then I wanna reassess my patient. Look at their oxygen, plus they would be on a continuous pulse ox, so I can kind of monitor that during the procedure, make sure that they're doing okay. Of course, if their saturation drops significantly, if they're turning blue, if they're coughing and they can't breathe, I'm gonna stop the procedure. So I'll reassess my vital signs, reassess my lung sounds. Hopefully I would expect to have some clearer lung sounds afterward. So I take off my PPE, perform hand hygiene before I do my reassessment, and that's the sectioning part. Okay. So we're gonna do this as like 2 skills together. So now, after I section, I'm gonna do a dressing change and change the inner cannula. Remove this. Take off my gloves, hand hygiene. So that part of the procedure is done. Okay, so on the second skill, we're kind of skipping past the opening act. We've already done that with our sectioning. So now we have our tracheostomy kit here, our inner cannula, and then our new little Velcro thing. So for this, the main sterile part of this procedure is the changing of the cannula. Okay, so that part we really want to be really careful about being sterile. We're going to continue to keep our sterile hand as we're changing the dressing and doing some cleaning. But kind of halfway through that, it's like both hands are going to become clean. Because now we're only dealing with the outside. There's something on here that says, prepare tape that is long enough to go around the patient's neck. So that we're not doing. You just have like this nice Velcro neck strap. That would be if you have to like pre-cut a neck strap. And then there's 2 methods. There's either a non-disposable inner cannula, which we would wash, or a disposable cannula. So we're gonna practice with the disposable cannula. So I take the old one out, throw it away, and I put a new one in. But that's why there's those 2 methods there. Okay, so I'm opening up my kit. This one's already open, but so I would just carefully open my kit here. Carefully open my inner cannula. And then again, I'm going to add, not actually, but I'm going to add a little bit of normal saline to one of my little bins here. So first I'll take out my sterile gloves. Actually, pain gloves. What do I want to do first?
Take out the...
Yeah, so I'm going to take out the old dressing. Here for a minute, I can clean the trash. And so you're doing a skin assessment. So just like other stomas, right, for a colostomy, what do we want to see here? We want to see like no abnormal drainage, no signs of redness, irritation, skin breakdown. So that's what we're assessing the site for. The other thing you always want to know is that we're always keeping this collar in place. So even during changing, I'll show you how we'll kind of change it by always keeping the old one in place. We never want to take this completely off because if the patient coughs, then all this can kind of just come dislodged. So this is like our little protection here. Okay, so I took off my old dressing. I'm assessing the skin. Okay, everything looks good. So I'm ready to put on my sterile gloves. These ones definitely aren't as user friendly as the other ones.
Professor, I know that we can only suction 3 times, but up to the third time, if we can feel like there's still more mucus in there, we still have to stop. We don't continue.
Yeah, I mean, so that's like kind of 3 times within a, one little sitting, right? So if let's say I do my 3 suction passes, I reassess, I check the vital signs, I listen to the lung sounds, and it still sounds like they need more. I can do some more, but there's been several minutes in between.
Several minutes.
But it's just when we're, repeatedly doing those passes, only 3.
Okay, good. Yes. Thank you.
Okay, so I have, and then this is just like another drape that just put on the patient. So in here, I'm gonna just show you guys what we have. So this is like that string that could be a tie for the neck strap, but we have the fancy Velcro one, so really you don't need this. This equipment is if you're using a reusable cannula. So if we were using a reusable one, you put it in here, you have to rinse it out and clean the inside with pipe cleaners. But again, we're not doing that. I'm just going to show you guys the disposable one. And then we have our little swabs here. So this we're going to use for cleaning. So that I'm going to dip into the saline. And then I have a pre-cut new dressing that we're going to be putting on afterwards. And then there's 2 pieces of gauze here. So one you can wet if you wanted and use for the cleaning. And then the other one is the dry one to pat dry. So that's kind of all my stuff that I have there. Okay, so now at this point, let me just make sure. Okay. So this hand is now going to become my clean hand, right? So I'm going to reach in. You have to like twist and pull out the inner cannula. So like I said, this is disposable, so we're getting rid of it. If I needed to rewash it, I would put it in here and wash it. So you want to have this package already open, because I need to take out my new cannula, inner cannula, that I can place inside the patient. I don't know, okay, so that was my new one that I did just with my sterile hand, right? So now I'm going to clean around the outside. So again, this hand I can use to kind of adjust the little neck plate here and to kind of get around things. But I do want to do my cleaning with my sterile hand. So I'm going to take my swabs. I'm going to lift up the plate. You're going to clean around the stoma site. Make sure, if there's any, drainage, any dry blood, anything like that. We're cleaning all of that away. Remember our principle of aseptic technique, so trying to go from clean to dirty, not dirty to clean towards the stoma, right? So cleaning out. Again, you can use this. This is moistened with my normal saline. If you wanted to do any other cleaning around the site. And then now I can use this one to just kind of pat dry. Now we're not as, with Foley catheter, it's like this hand, you know, can't touch anything else, you know, as you can see. I'm kind of getting close here, right? But it's not, the mostly sterile part of the technique is done because I've inserted this inner cannula. So it's just a different type of sterile technique. It's not as stringent as the Foley. So now I have my new dressing I'm going to put on. So now at this point, you know, I can use both hands. You want to take some sort of, usually it helps to have the end of a swab stick or something to kind of help you fit it under the collar here. Pull from the top. So we just want to put it in place just like that. Now if, let's say something were to happen to this dressing, can you just take a regular 4x4 and cut it? And put it on the patient?
No.
No, so what would be wrong with that?
It's not sterile.
The scissor is dirty, not
Um,
sterilized.
Yeah, kind of. So even beyond that, you know, it's again kind of like I hope I told you guys this. So we don't want to ever modify stuff, or I think I used this example with the isolation gown of like punching a thumb hole through the sleeve, right, to make it fit better. We don't want to compromise or modify anything ourselves, right? Because especially if I'm cutting a regular piece of gauze, this is like specifically treated, so there aren't any little loose fibers that can go on the tracheostomy. So we don't want to just modify and cut things ourselves. So just so you kind of know that. So I put my clean dressing on, and then what's my last step?
Change the strap.
Yeah, so you're gonna change the collar strap. So where's my new one?
Sleepy sister.
So these are adjustable. So it comes in different pieces. So you can make this, you know, smaller. You can make it bigger. So what we want to do is we're going to put it around our patient. But we always want to strap one side and secure it before we, you know, take the other side off. Put it under the plate here and tie that one securely. What I like to do, I do both sides. So I'll just loosely attach both. Then I'll take my old one off. And then I adjust the new one as needed. So now I can kind of tighten this, tighten that, you know, adjust this part. But that way, you know, this is always attached at all times. So we never want to just take both sides off and have nothing there. And then yeah, so then I changed out my new collar and clean up all my stuff. My hand hygiene and do my closing act. And then that's it. So sectioning, you'll have an order for sectioning, like, you know, probably PRN, or, you know, how often you might do it if it's scheduled. Or again, if it's the respiratory therapist doing it and you're assessing your patient, you're noticing that they're kind of having some shortness of breath, or they sound like they're, have a lot of mucus in their upper airways, and you call the respiratory therapist and have them come section your patient. And then dressing changes are probably done once a shift and PRN. So again, if it got a lot of mucus on it related to your sectioning, then I would do a PRN dressing change. So yeah, so for your assessment, you guys will do both skills at once. So you'll section first, then you'll go into the dressing change and changing the cannula, and it'll be combined as one skill. Any questions?
Hopefully the patient can be changing the dressing.
No, it shouldn't be painful. Yeah, so you do want to, you know, be careful. But yeah, you can, you know, move this plate up and down and kind of manipulate it a little bit, you know, without being rough. But yeah, so it shouldn't be painful. Any other questions? there are, there's like multiple videos if you guys haven't watched them yet in the ETI. So this is the one, sectioning with an open system. And then it's like, I don't remember what the title of the video is, but tracheostomy care. So there's two videos that you guys should be watching. And I think, I don't remember, do we start assessing this next week? It might be next week. Next week or the week after. So that way you guys have the rest of today. You know, we have about 2 more hours. I'm hoping, I don't know if I'll get through everyone. There might